Hello, everyone. Welcome back to another episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend Sarah Covington, who's the head of legal at Tracy Health. Thank you so much for your time today, Sarah.
Hey, Dylan, thanks for having me.
And could you just kind of give us a 10,000 foot overview of what is the story of Tracy Health?
Yeah, absolutely. So Tracy Health just launched in January, and it was a pretty exciting project to get to be there at the ground level. And it's a solution that's geared for wound care and ostomy patients. And we started out with offering virtual visits, but we've kind of realized through the course of engaging in this segment that really what's needed is more of a hand-to-hand patient education. And so we are transitioning over into that model, which is pretty exciting to us.
Awesome. And without going too much into the weeds, what's the difference between kind of a direct care to like an educational model?
Yeah, with the educational model, we're focused a little bit more on resources and providing some support that goes towards those caregivers that are in the home with the patient and helping support their dressing changes. You know, at
Mm,
discharge, our nurses are doing as much as they can, but there's an education gap in how to care for these wounds once you get home. And so, switching from just like, hey, here is a virtual telehealth appointment over to, hey, how are we going to come together as a community within our home to help care for this patient?
awesome. And that leads nicely actually into my next question is based off of your experiences and kind of what you've seen, like could you just give us an overview of kind of what rural health has been either nationally or kind of locally, and why organizations such as Tracy Health can help bridge the gap between kind of that urban versus rural divide when it comes to healthcare resources.
Yeah, absolutely. So, rural healthcare is something that I am super passionate about, and that stems from living in a rural environment myself. So, I live in Piedmont, South Dakota. We don't even have a stoplight. We have some pavement, but it's only in front of like the library and the post office and the volunteer fire department. Outside of that, we've got some dirt road situation going on. And when we think about healthcare in America, I don't think that we tend to keep in mind the limitation on services that are prevalent when you are receiving care in a rural community. And by that, I mean there are times that we don't have access to an ambulance service, right? We'll get a text notification that EMS is down. When we're having a blizzard and it's, negative 30, negative 40 degrees and not safe for those individuals that provide those services to be out in the community,
Mhm.
they're just not available. And I think when we're thinking about healthcare in America, we don't really think about there not being the availability to call 911 and get somebody to come and help you at your door. But that's actually very much a part of what we deal with. Another thing that I think we tend not to think about is um, there are no pediatric cardiologists in my region. We have pediatric cardiologists that fly in once a month from Omaha, Nebraska. It is amazing that they provide that service. But it also means, as a parent with a child that has to be seen by a pediatric cardiologist, that I have to plan ahead. I have to make sure
Mhm.
that we get their appointments right when they're in town. And those appointment slots are pretty limited. And so, even just some of the specialists that we tend to think of as being kind of normal specialists that you would need to go to day in and day out,
Mhm.
there are definitely some limitations on that availability. And when you have health systems, right, they're going to staff based on population draw. And so we're going to look and say, all right, how big does our population have to be to support having this particular type of specialist in that community? And if the population draw isn't large enough, that specialist just isn't hired by that local health system. And also, conversely, if we're talking about independent practice, there really isn't enough sort of business in the area to support that either. And so, when we're creating healthcare solutions, I really love to be part of teams that are focused a little bit more broadly on
Mhm.
creating solutions that aren't predicated on what does a local population look like, but rather are focused on how do we deliver accessible care no matter where you are.
Mhm. And you brought up an interesting point. So kind of based off of your experiences in kind of your healthcare career, like what are some of those common kind of things that you've seen that populations need, regardless if they're in a more urban setting or in a more rural setting?
I think just consistent access to nursing care is important, and regardless of sort of which area or segment of nursing care that is. So here's kind of another story from my life, right? Our pediatric cardiology nurse is amazing, and our daughter needed to see a dietitian. There are no dietitians in our area that were going to be able to see our daughter, that were willing to see a pediatric patient. We know that licensing restrictions are part of our realm of the world. And she was able to, I had given up already. She was able to connect with a dietitian that was 6 hours away. We were their first telehealth patient. Our nurse arranged for that too, so that our daughter could receive the dietitian services that she needed to get on the right track.
Oh, wow.
It's those individuals in the community, those nurses that are really driving forward and having that connection with what patients need to be able to source out and get connected with it.
And was this was all like pre-COVID?
No, this was actually post COVID.
Oh, this was post-COVID. Oh,
Yeah.
wow.
Yeah. So I don't know, South Dakota didn't really shut down very much for COVID. And so while some other areas, I think, of the country had much broader telehealth adoption, it wasn't a routine here. There were many providers locally that didn't develop telehealth solutions.
Oh, wow. And so when it came to, let's just say you're a resident in South Dakota and you get sick, is it kind of like, you know, you kind of really have to scramble to kind of see who's close by based off of what particular sickness you have that's specialized or not specialized. So is it kind of like a free for all? Is kind of what I'm understanding.
It sometimes can feel a little bit like a free for all, but to that, I would say we are pretty fortunate to have some incredible primary care physicians locally.
Mm,
And as you know, critical access hospitals, they're prepared for whatever comes in the door. And so we do have critical access hospitals, and it might be something that if we were in a larger city, that patient would be routed directly to a level one trauma center, but we don't have a level one trauma center. So that patient is first seen in the critical access for stabilization, which is pretty incredible and amazing that our clinicians there are ready and available and have those doors open.
yeah. And one of the things that I've started to learn is that there's this correlation between um, kind of medical residents who come to an area to complete their residency, and then more or less they stay in the area to continue practicing medicine. Based off of kind of where you are in the country, has there been kind of like a push to kind of encourage people to not only do their residency um, where you are, but also to as well uh, stay there and continue practicing medicine?
There's definitely a push for it, but we have to remember, like, we're competing with much larger urban environments. And so, yes, absolutely. And we are so grateful for those that do come and do their residencies here. And, like, yay, even more so those that continue to provide care in the community and stay. But a very real limitation, I think, that's faced in rural areas is that competition with those urban markets.
Mm. And and a lot of it, it seems like has to do with the salary is kind of a big driving force. Potential opportunities to specialize, the amount of hospitals you can choose from, kind of what else do you kind of see as kind of the or what's push I guess another way to phrase it is what's pushing people to go more towards those urban areas based off of what you've seen.
Yeah. So, for example, in Western South Dakota, right, an entire half of the state,
Mhm.
we have one health system. And so if you come here and you do your residency and you plan to stay, you know exactly what those limitations then entail. When you're in larger urban environments, I think it's a lot easier to negotiate between multiple offers and that you end up with a little bit more favorable salary positioning as a result. Locally, there really isn't a lot of competition or availability of other health systems to work with if you decide that you don't want to maintain where you're at.
Oh wow. So it's kind of like, this is, I guess, the old image of this is what you're having for dinner. You either eat it or you starve.
Or you can go over there and they have a whole buffet.
Wow. And, you know, the next question I want to ask is how do you see companies such as Tracy Health contributing not only to kind of this evolution from a direct care model to an educational model, but kind of a subset of that is how do you see it, the organization contributing to kind of the larger AI healthcare conversation that's been picking up steam the last couple of years?
Yeah, so interestingly, Tracy Health is in the early stages of launching an additional solution. So we built our MSO to be able to support multiple PCs. And there are many MSOs out there that are built around a captive PC model, meaning the clinicians that are involved don't actually really own anything. They end up being 1099s. And what we built for our MSO was a structure wherein our clinicians own their practices full right, and we are providing the back end administrative support services. And so, one of the ways that I see that we will be contributing to the AI space is that we are positioned to support startups,
Mhm.
uh, those that are in practices that want to grow and take it to the next level, and with that, also those that are wanting to do practice launches. When we look at those segments, I think that we're going to see some high AI drive, particularly within the startup space, and excited to be providing support services to those in that arena.
Yeah, because it's quite interesting. It seems, um, that the rule settings have, you know, it's been a slower adoption, and it all goes back to kind of what, the beginning of this conversation was about was, about access to resources is what it fundamentally comes down to.
Right. And as we're engaging in using more digital health solutions in these rural environments to bridge these care gaps, having AI enabled solutions that help elevate the care, I think is going to be a really interesting inclusion as we continue to develop.
And my last question is, what do or in your mind, like, what do members of Congress need to understand about rural health, and then also to like this, needing to transform kind of from a direct care model to a more educational based model?
Yeah, I think that providers really need some solutions to provide more direct care. And when we look at cost of living and wages, we know that in rural environments, people tend to make less. But
Mhm.
what we don't see is a correlation to having lower deductibles in these environments. And so, what I mean by that is you can have someone in an urban environment and someone in a rural environment. There's a disparity there in pay, but there's not a disparity there in what that deductible looks like to utilize their health insurance. And so, understanding that financial barrier is a little bit higher for
Mhm.
those in environments where their pay is less is important, and creating solutions like we recently had legislation passed both in Texas and Tennessee wherein patients that are availing of direct care solutions can
Mhm.
have the payments associated with those applied to their deductibles. I think creating solutions where we can continue to support a direct care model because we know that there's less administrative expenses involved in those is
Mhm.
important for Congress to understand. And I think continuing to have pathways for reimbursable telehealth for insurance based um, care is important. So Medicare comes to mind, right? We know that incident to guidelines may be changing at the end of the year, and that will affect companies in their provision of telehealth services. We also see a huge shift right now in companies taking a step back from providing telehealth services. And I have to think that if there was a little bit more support in terms of our statutory guidelines that are available to us and also reimbursement available for telehealth, that we would instead continue to see adoption.
Wow. And kind of a subset actually of my last question, um, because you brought up another great, fantastic point, is is the reimbursement rate. Let's just say, Jim slips and breaks his leg in a city, and then he also slips and breaks his leg in a more rural setting. Is there going to be a difference in how the kind of insurance company kind of reacts to both of those instances of Jim, even though they're the same?
When it comes to CMS, yes, CMS reimburses more in the urban environment than the rural environment. So you'd have to go and look, which city and state is Jim in for both of those falls to be able to come up with what that reimbursement looks like. But yes, there's variation.
Awesome. No, that's great. And Sarah, where can people find more about you or about Tracy Health if they're interested in learning more?
Yeah, just come and join me on LinkedIn. I'm there all the time. We also have LinkedIn pages for Tracy Health as well.
Awesome. Well, this is your host, Dylan Reed of the AI Healthcare Podcast. Don't forget to subscribe on my YouTube channel, as well as subscribe on my LinkedIn, where you will receive the weekly AI Healthcare report. This is Dylan Reed, your host, signing off. Thank you so much again.